Hi, I'm Colin Hung with Healthcare IT Today, where we explore the latest technology trends and interesting stories in health IT. On this episode, we're going to be exploring how a payer has deployed analytics as well as AI for the benefit of their members. And with me today is Casey Dudek, who is a business analyst at Evernorth Health Services. Welcome to the program.
Thank you. Happy to be here.
I'm excited to be here with you here at the SAS Innovate Conference. And you were on stage talking about some of the innovative uses of AI and other technologies like that at your organization. So before we get into that though, can you maybe, just for our audience, tell us a little bit more about Evernorth?
Yeah, so I think more people are familiar with Cigna, right? Health insurance. But Evernorth grew out of Cigna. It's our health services division. So this is where we're doing a lot of our developmental analytics for providing these solutions that health insurers will be providing. So, and my role specifically, I do analytics. So, and I kind of dwell in this space of customer and clinical analytics. And I specifically focus on this population that has chronic conditions. So, all that to say is my work is really focused on improving the healthcare outcomes for patients with one or more chronic conditions. And right now I'm really focused on this idea of trying to align the next best action a patient can take to really improve their health to the best outcome possible.
So when you say you're applying analytics to folks with chronic conditions, are you looking, what kind of data are you looking at to base some of this?
Right, so a lot of it's based on like historical claims data. We call it doctor data, right? You go to the doctor and it generates a lot of information. And then we have different kind of demographics about these customers, like where are they living and kind of what is the environment they're living in, to kind of build this picture of who is the person and what are they experiencing.
And what's the ultimate outcome that you're hoping to drive through the analytics? Are you helping to reduce the overall costs of their care, to make sure that they're getting better outcomes?
I mean, ideally everything, right? And of course we're a business, so the bottom line matters. But a lot of times, luckily for us, a healthy customer is also a less expensive customer. So driving someone towards surgery, maybe surgery looks really expensive, but like the whole person health there, maybe the surgery is the best outcome for them and then for us as a business, because then after that they're going to be a happy, healthy customer.
And what are some of the challenges that you've run into as a payer of gathering all this data? Certainly you have access to your own data, but you just spoke about some of the data that's available through perhaps the doctors and other things. Talk to me about that.
Oh my goodness, yes, you've hit on the question I think anyone in analytics, and especially in healthcare, is working with, just between patient privacy and all the different potential streams of information. I think that's something that Evernorth is always working on, Cigna's always working on. How do we pull together these streams of information in a responsible way? So for me, that looks like multiple different places the data is stored, and I have specific access to pull them all together. And the company does a really good job of making sure we can link them by like, okay, this person is the same across all these sources. Luckily, I don't have to deal with that. I just pull it together to build the picture.
Gotcha. When you were on stage and you were talking about the makeup of the project teams to ensure that you have representation from all the different stakeholders.
Yes.
How important is that when you're talking about projects like the ones you're talking about here?
It's really important. I think it depends on the scale of the project. So one of the things that my team is really involved in is really whenever we've either developing products to bring to market or we have products that we're utilizing, we need to make sure that they are effective. So maybe we've already have something deployed, people are using it, we need to say, hey, are there better health outcomes there? So, and is it cost effective? And in that case, it's really like kind of a one-on-one partnership maybe, or two, like it's us in analytics, it's product and sales, the owner, the representation of that product. And then on the development side, there's sometimes more people involved because there is more of that like newness, I guess. So we have the analytics, which is really maybe not important for like deploying the product, but really important for like bringing together the questions of the data collection that's needed. And so maybe engineering is more like in the front and center for this, but we're like throwing all the questions to engineering saying, hey, we need to be able to answer this, so we need to have this built into our system now.
You've done a lot of projects by the sound of things.
Yeah.
What are some of the best practices that you've picked up over your projects in terms of how to handle the data and then working with the analytics engines?
Right. I mean, communication, which is such a simple concept, but it's so important for really kind of understanding the ask and what we're truly trying to accomplish to make sure we've got all the pieces, and then grabbing different people, bring them into the room to have that conversation of who else has a perspective here that matters. And sometimes that's a really hard question to answer, just who has something to say here that's important, because maybe it's an idea that happened here, but it's impacting a lot of people. So always thinking about that potential outcome and impact really drives this question of who to involve. But since I'm in analytics, I'm always giving this plug of, even if it doesn't seem like an analytic endeavor, a lot of times there's value to add there, because at some point we're going to need to check in and say, is this working? And who's going to do that? It's going to be your analytics groups. So involving them early is important.
Now, in your presentation, you brought up a slide and you called it the Goldilocks
yes.
moment of the right amount of involvement from all your stakeholders at the right times. Tell us a little bit more about that.
Okay. So you're referencing this Goldilocks. So I said, if everyone that needs to be involved is involved together at every step, it's not going to work because it's just too many voices in the room. And then we also swing in the opposite direction where it's too few people.
And by these people, you're talking about the different departments.
Yes. And I think this concept holds true all as you narrow in onto the idea. It's like how many people are doing the work and how many people are there observing the work, right? And you need the right balance there. But I had this, like you said, this collaboration grid of really talking about who needs to be involved. And so thinking about that, we're talking about maybe for one of these projects, we're working on identifying a population to bring into the product. The very, very first step. And you would think, maybe that's a clinical decision, or maybe that's an analytic decision, but we had 4 groups involved, right? We had clinical design teams, we have analytics, we had engineering and product and sales. And that's, and we had that kind of perspective on all steps of our roadmaps, who needs to be involved, because one group really doesn't necessarily have the answer, and we really want to be able to scale it and iterate on it, so we need these different perspectives. And even just, because it's healthcare, I guess we're working with people, and people are complicated. And so analytics, we're so data driven, and data is so important, but it always needs to be recontextualized. Can you make a clinical decision using this information, our insights, or can you direct someone to the right solution that product and sales is bringing to the stand with the data. So it's always it's a partnership between all the groups.
Now, we're at the SAS conference, so I would be remiss if I didn't ask you this question. How are you using the SAS platform?
So I think, as many large companies do, have a lot of options for our users, because our people that are doing analytics come from a lot of different backgrounds.
Sure.
And some people, I'm a data nerd and I'm a programming nerd, so I know multiple languages to access data, although SAS has my heart. So the environment we work in reflects this, and that's its own chaotic situation. We got people using R and Python and SAS and SQL. And so, SAS for me and for a lot of analytics, we do a lot of, like I said, product evaluations. We use this and we also use it for development. So we will pull in our data and use it to both manipulate it and really clean the data, and then also derive insights so we could report back. So it's used in a lot of reporting. Okay. And then it's also used for some of the development side, although ultimately, currently a lot of our engineers, they only use SQL. Right. So at the last, once we've figured out what we're doing in SAS, because that's where we're fastest, that's where we're most efficient, that's where we can, fail fast, we can move it into production in a different language. Yeah.
Awesome. No, I appreciate that.
Okay.
I appreciate that context. That's really helpful. What's sort of exciting you over the next 12 months? Is there a project that you're really looking forward to at your organization?
I am. I wonder how much I could talk about it.
Okay. Give us a little tease.
So this, I talked about today, this guided care for pain, which is really this end-to-end solution and support for people that are on a trajectory for a certain kind of outcome. But I'm very excited to be really kind of honing in on, as I've mentioned earlier, this aligning people to the next best action. And part of that is really delving into the fact that people are complicated. So like from a clinical perspective, we might see someone's got, shoulder pain going on. But if you got them on the phone and asked them what's going on, maybe they're talking about being depressed. So people have different priorities, and that doesn't always surface in the data. So it's really taking the options available to them, which are usually quite overwhelming, and narrowing it down to from a clinical perspective, like, I think you might be interested in any of these things, and then
presenting that back to the patient as options.
Yeah,
Gotcha.
exactly. So, that's kind of an idea that we're focused on, and I'm hoping to see, fruition of that.
Nice. Casey, you shared a lot of great information with us today. Where can people go to find more information about Evernorth?
Well, Evernorth has a website, and evernorthhealthservices.com. So if you can Google that, it's also linked from the Signet Group page, so it's always a great resource of information.
Well, Casey, thank you so much for being on our program today.
Yeah.
I really appreciate all the information you shared.
Yeah, no problem.
This has been Colin Hung for Healthcare IT Today. And hey, if you liked the content of this video, you'll find more at healthcareittoday.com. Thanks for being here, and I'll catch you on the next video.